of cancers and some of the causes behind some of those. Okay. And some of the things that we can do, as folks from the diaspora to mitigate some of the reasons behind the cancers. Okay. My name is Ruby, and I will be your host for tonight. We also have Horace Davis on the call and Dr. Beckles, who will be presenting shortly here as well. So, this particular webinar series, I'm going to share a little bit of background, is brought to you by Trinbago Progressive Association of the USA and Caribbean American Association of New York, better known as CASONI. A little bit of background here. The webinar series came to be. It was an idea between Dr. Beckles, whom you'll hear from shortly, and Mr. Horace Davis, who is the founder of CASONI. Together, they envisioned a free public webinar series designed to strengthen our community's health literacy, promote self-advocacy, and help dispel long-standing misconceptions about important health issues within the Caribbean community. Dr. Beckles has prepared a brief presentation for us, per usual. We kindly ask that you hold your questions until the end, and that way we can have a more productive and focused discussion, okay? We'll gladly take as many questions as we can at the end. But with that, I will introduce Dr. Beckles. So Dr. Beckles is a Trinidadian-born heart surgeon, Tobago in the house, with over three decades of clinical expertise in cardiovascular disease, education, and research. He is the Chief Medical Officer of Trinbago Progressive Association, as mentioned earlier, and has teamed up with CASONI to bring clarity, awareness, and knowledge on some very important health conditions. Dr. Beckles is highly respected. He's a very highly respected cardiothoracic surgeon, very well known, and we're truly fortunate to have him with here tonight. We're truly fortunate to have him with us here tonight to share his insights and expertise. With that, I will turn it over to Dr. Beckles. So without further ado, I don't believe I left anything out. If Horace Davis has anything to add before we get started, so be it. But I will go ahead and I will give the floor to Dr. Beckles.
Okay, very good. Good evening, everyone, and thanks for being here. Many things you could be doing this evening, but just thanks for joining this group and this community. So March is Colon Awareness Month, and so we want to anchor on colorectal cancer for this talk. But I also want to highlight other cancers that affect our families. So tonight's message is going to be very simple. Screening is not extra thing to do. It's protection. All right. So that's the sort of theme. It's actually protection. So for several cancers, screening can find the cancer early when it is most curable. And that's where colon cancer is one of those cancers. So the talk is designed for American Caribbean people, but it's basically for everyone in New York State and beyond. So we have people globally, and I'm happy to see that. Excellent. I'm going to start in my talk. And for the introduction, thank you so much, Ruby. I am a general surgeon and I'm a cardiothoracic surgeon. So I'm double trained, double fellowship boarded. So yes, I do see patients with cancer, although I am a heart surgeon. And you will see more about that later. So let's get into this. The agenda is going to follow this simple red that's highlighted. So why discuss cancer in the first place, right? And then we're going to give a big overview trend. And then what is cancer anyway? What is this thing called cancer, right? And then what are the risk factors for cancer? We're going to get into that, and we're going to get to the meat of the matter in the end, where cancer prevention and early detection are what you need to do next, step by step. So when we look at, this is a very familiar slide with everyone, because for the last 3-4 months, we've been talking about cardiovascular disease as being the #1 killer. Well, guess what number 2 is? Yeah, you guessed right. Number 2 are actually cancers, right? And that's the number 2 on the planet. So I want you to look at that number pretty carefully, because 10 million people die every year. And that's not fake news. They die every year of cancer. Yes, some of them are actually, elderly and in their 80s, but you're going to see that actually quite a bit are actually on the young side too. When we look at the numbers overall, this is from the World Cancer Day 2020 2025, 2026 team. And you can see here that 1 in 5 people will develop cancer during their lifetime. Every 5 people on this call, one will have it. About 1 in 9 men and about 1 in 12 women will die from it. So when we look at the numbers, 20 million people get cancer, but half of them die from it. So it's a 50% chance of dying. So that's a pretty high odds of mortality when half dies when they get it. And of course, the bill is $1 trillion. It costs a lot. Well, unfortunately, the things are moving so fast that sometimes we're not aware of what's going on in the healthcare field. And that's what this webinar is all about, is bringing that awareness to just pause for a minute. And you're gonna learn something tonight, I promise, as with every webinar. You can see here from the CDC, 1 in 2 men and 1 in 3 women will develop cancer during their entire lifetime. So get ready for it. All right, it's coming. We just have to know what to do, take some steps. We want to be in that 50% that don't get it. Or if we did get it, what can we do to not letting it happen again? When we look at the numbers that came out recently, it was very shocking because the numbers keep decreasing and decreasing, and younger people are getting cancer. So for the first time now, of all the cancer deaths, people under 50, the number one cause of cancer deaths in men under age 50 is colon cancer. Not getting it, dying from it, unfortunately. And in women, it's the number two leading cause of why they die of cancers under age 50. So that we bring massive awareness in February every year, but that's for all the different cancers. And you can see there are many different cancers. But today we just want to focus on colorectal cancer. You can see here that cancer, we always thought, yeah, it's something when we get old, right? Wrong, right? Look at the age group, the median age group of getting cancer. This is getting the cancer, not dying from it, because you can survive after cancer, as I'm sure there are people who know people who have cancer and actually survive it more than 10 years. But you can see here, it's not discriminatory. Any age can get cancer, any continent can get cancer. This is globally. So it's not something to say, I'm not going to get cancer. I want to show a little video here. Just take a 1 minute video. Let's see if it comes up, if it can.
Dr. Beckles, we can see it, but there's no volume associated with it.
There's no volume.
Correct.
Okay, let me see if I can get the volume to play. I think there have to be another setting for the volume, right? When it's a YouTube video. All right, I'll figure that on. We'll play it in the end. Let me go back to my talk then.
Okay.
Hold on a second. Yeah. So we can have IT help to pull it up.
Yep.
To get back to my screen, I have to close everything out.
Okay. Mhm. If there's a hyperlink for the video, if you send it over to IT, they can probably pull it up that way.
Okay, sounds great.
Mhm.
Let me just continue then. Can you see my slide?
Right now, I'm seeing you. Just
Okay, good. Let me. Somehow I came out of sharing. And share.
Yep, we can see again. It seems to be like a
The
screenshot
vid
of the video.
Okay, so here we go. But I'm going to continue with the talk then.
Mhm.
So when we look at the lifetime risk of cancer, why does prevention matter, really? And so when we look at the lifetime risk, we see, I already showed you remarkable numbers, but it all have to do with age. So cancer rises as we get old, but not because we're young, it means we can't get cancer. it is related to family history. So if you know anyone in your family that have cancer when they were younger or a sibling that have cancers, yes, you're at an increased risk of actually getting cancer. So it means genes do play a role. And prevention and screening, it works together to reduce dying. So although you have colon cancer, you can reduce your chance of actually dying from it by getting screening, which is what we'll talk about in the end. So different things to talk about. Now let's look at the holistic view just for 2 minutes. Holistic view is we talk about the number of people having cancer. This is the top chart shows in men, prostate cancer is the most common cancer in men. Okay. In women, breast cancer is the most common cancer in women. Lung cancer is the second in both, and colon cancer is third. So these are the three cancers that after we finish with this webinar, you need to look and see when was the last time you got screened for each of these, and that's what the focus will be on at the end of the talk. Now, when we look at the deaths who die from cancer, lung cancer is still the number one killer in terms of cancer deaths. And yes, prostate is number two, and breast cancer is number two in women, and three is colon cancer. So colon cancer is up there. It's not as high as lung, not as high as prostate, but it's the third leading cause of preventable death in this case, because we can prevent it. Now, if I showed you a map like this, and I say, okay, what's on this map? Let's say this was COVID in green. Would you go get screened? The answer is yes. Well, for men, this is prostate cancer is in green in incidence. So yes, so men at the end of this talk have to get their prostate screened without a doubt. When we look at why men die, lung cancer is the number one cause. All right. And the third cause I said was colon cancer. In women, again, if you saw this map and you said, where is pink? That's you're at risk of getting something like a disease. Well, that's the whole planet. Almost the whole planet is in pink. So yes, women should get their mammogram done without question. And when we talk about why they die, then lung cancer in North America, but it's still breast cancer in South America and the rest of the world. Now, this is a trick question. Which is the best kind of cancer to get? Right?
None.
Very, very good. So of all these, this is the 5-year survival. So we would say prostate cancer is the best cancer to get because it has the best 5-year survival. 98% is alive still after 5 years. Think about the people who have, prostate cancer who they're still alive 5 years later, 98, 99% of them. Okay. When you think about people who have pancreatic cancer, some celebrities like Steve Jobs, he died within a year, right? So these are the worst cancers. Colon lies in the middle. Okay, so it's still not to be messed with. Still 50-50 chance. Just want to put things in perspective when we talk about different cancers. So you have breast cancer up here, 90% chance of survival, so pretty good survival. And then you have things like esophagus and stomach down here. So it's a range. Now, when we talk about disparities, there's no doubt that there's disparities across the entire globe. And when we look at the higher burden and the earlier presentation, there's no one reason for it. Okay, we just can't say it's just genetic or it's skin color or it's because Caribbean descent. It's a number of factors. It's really access, it's delay, not getting the screening done in time, it's awareness, right? It's insurance, it's a lot of things. And today it may even be immigration issues. But screening closes that gap. So imagine that screening closes the gap. So this is the fastest way to close any gap is just getting the screening done. No excuses. All right. So what exactly is cancer anyway? We talk about cancer. We talk about how it's all over the world. Well, there are 200 different types of cancer. And cancer is a disease when one cell divides uncontrollably. It just keeps dividing and dividing and dividing. Now, the human body is created to fix those mutations that lead to the first cell to start dividing. And it's when that machinery goes wrong is when we get cancer. When we look at the website, there are more than 200 different types of cancer. So it's not just the 3 top ones I'm telling you about right now. These are just the 3 most common ones, but there are 200 different cancers that pick up almost every letter of the alphabet. You can go click on each of them and you'll find them. But what is really going on? I want to look upstream because that's what really matters is we have the downstream disease where you show up with the cancer, but what really happened? What's causing it? And we could just take a peek upstream from a scientist's perspective. You'll see here that every day in the human body, we acquire trillions of mutations. Okay. Not like these mutation, Ninja Turtles, right? But we're talking about mutations inside our cells. And so as the cells mutate, it means that it had a mistake in it. And that mistake, the body have to correct it. And the only way we can correct it is by giving our body what it needs to correct it. And you're going to see later on how diet plays a role in that. What we eat determines if our body have the immune response to correct these mutations. Now, we talk about, this is just to connect the dots. Trillions of mistakes, trillions of mutations equals 20 million people getting cancer and 10 million deaths. Connecting the dots, that's all. So what are the risk factors for cancer anyway? Who's to say who's going to get it and who's not? Are there clear risk factors? Can you say if someone have these risk factors, they're going to get cancer? Well, we know smoking. Smoking has been shown for the last few decades. Up to 50% of people used to smoke cigarettes in the United States. Now the whole world is decreasing tremendously, as you can see here from this global map of where we were and where we are today. And so it's decreasing rapidly, and it's good to see that. Just smoking alone, one entity alone, you can see here how it's responsible for 21 times risk of lung cancer, right? Even stroke. 3 times, right? Colon cancer, 1.3%. But look at how many different diseases is caused by just smoking. And that's why, of course, in most countries, it's banned, no longer in restaurants and on airplanes. This is the reason. When we look at smoking, it comes in number 3 as a risk factor. We talk about, you've seen this map before, hypertension as number 1 risk factor. There's pollution. And then smoking is number 3. It's pretty high up there, right? In terms of causing deaths in the world. So it's a pretty bad risk factor. Let's talk about another one, alcohol use. Again, it's more of an abuse problem. One glass of wine shouldn't hurt much at all. It's the incessant amount of alcohol that really is a problem. But overuse of alcohol has been shown to cause up to 7 different types of cancers. So it's something to be aware of. And we'll see how that plays in after you have a diagnosis of cancer. People always ask, hey, can I drink after I have chemotherapy going on right now? Could I take some alcohol with it? Well, if alcohol causes cancer, maybe that's not a good idea. And so when we look at alcohol, where's alcohol in the whole risk factor for the world? It's down here somewhere, right? 1.29 million people die from alcohol abuse. When we look at the third one is alarming, and I'll tell you why. It's because just being overweight or being obese is associated now with 13 different types of cancers. 13. And yes, colon cancer is one of them. So the more concerning thing is that over the last 40 years in our lifetime, for most people on this chat and on this webinar, our kids under age 19 are actually 10 times more obese. And I think that's why we're seeing now younger and younger people getting cancer. And so it used to be 50 and now it's 45. It's going to be 35 eventually at one point. But this is a global problem. And we've mentioned that on most of our webinars. Where do we put obesity? It's right here. So if we had to put the 3 risk factors, smoking, so you should stop smoking if you have cancer, obesity, try and lose a few pounds, and of course, alcohol abuse, try and cut down on that. But in this order, smoking is the number 1 and trying to lose some weight is number 2. And why is that? When we look at obesity itself, and we've learned this now from all the molecular science that's actually come out, right? Those adipose cells, those fatty cells are actually a source of carcinogenesis. It basically secretes cytokines that stimulate the entire cancer pathway. And so the same way those cells grow is the same way it can cause other cells to grow. So there's no doubt that obesity is not just associated with diabetes, like in our previous talk, liver disease, cardiovascular disease, but now malignant tumors is associated with obesity. And that's the problem. So that little pot belly, that little pouch, right? That's not good anymore, right? So that's symbolizes inflammatory cells and inflammatory cytokines. And for the first time now, we have that overlap with all our discussions on the metabolic syndrome, where one of the factors in the metabolic syndrome that causes heart disease and early mortality, the waist circumference, obesity, is now tied in with heart disease. And so, for all practical purposes, losing a few pounds, we have the technology today with GLP-1s. Today, this is the time now that we can actually lose a few pounds to help not just cancer, but also the metabolic syndrome, which is a very deadly syndrome. All right, cancer prevention. This is the fun part. Now we're getting into it. So this is just to show that whenever we have any kind of prevention that's put in place, many lives are saved. 80% of these cancers are preventable. Imagine that. Imagine 80% can be prevented altogether. And if you ask anybody who are cancer survivors, they'll tell you. They'll say, "Yep, I didn't get my screening done. I was too busy. I was working every day. I never put aside time." And really, what it's about is just not putting health as a priority. That's all it is. These are things we have to do. We take our cars for tune-up. We get our houses cleaned up for springtime. We make priority for a lot of things in life. But these people did not put their health as a priority to say, "Okay, this is March. I'm going to take time off from my work and go get my colonoscopy done." Okay. And that's the difference. So this is going to be using the ABCDEs framework that you saw already. We talk about ABCs for heart disease. We talk about, this is the overlap between diet and exercise. Well, here is the S. The S stands for screening. And so screening, it also stands for stop smoking. It also stands to watch your stress and to sleep better. But S, screening, plays the biggest role. And that's where cancer is coming. You could survive heart disease, but you can die of a cancer, clearly. So, and there's a lot of overlap in the risk factors, as I just showed. Now, when you look at the American, Cancer Society, you can go on there and you can actually check and see what's your risk of getting cancer. And it's going to go into family history, if there is any other cancers in the family, etc. The other framework we use is just awareness, ABCDE, but from an awareness standpoint, the behaviors that we have to change, like tobacco smoking, diet, the activities, checkups, like putting priority to getting your checkup done, making that a priority and scheduling on your calendar. And then detection is screenings again, and E is early action. So what I have talked about now so far, cancer tests. We talk about healthy choices. We talk about obesity and cancer. And we talk about how bad tobacco is for that. Let's look at a little study. When they look at, in United Kingdom, what % of people actually presented with the different stages? This is just stage 1 cancer. So this is very early cancer. They presented with stage 1, and how did they present? And you can still see that even in 2020, people are still presenting in the pink and in the red where it's urgent. It means that they presented too late when they have symptoms. By the time you have symptoms, it means that the cancer is already causing some real havoc to your body. And then by the time you have symptoms, you're looking at going down the chemotherapy pathway, surgery pathway, the radiation pathway. Whereas early, you can see here, on your left-hand side, for most of these cancers, it's very small numbers presenting early for screening. And screening, as you can see, is only in green, right? And these are the top 3 we just talked about. All the rest was basically sent by doctors, and patients have to be advocates. So you have to know, don't wait for your doctor to tell you what you need, right? You're going to have to go to the doctor and say, "Hey, I am 50 years old. I need these tests done. Thank you very much." And they'll be like, "Oh, okay, yeah, sure. That's great." All right. So early onset, colon cancer is the new reality. This is a new reality. This news just came out recently that there's been so many deaths, and it takes almost 5 to 10 years before they changed the guidelines. And that's very unfortunate because you could see here now, the guidelines used to be get your colonoscopy at age 50. Guess what happened? It's now 45. So for those of you in this chat, you may be behind the times. You may need to get ahead and step up there and go and get your colon screened because there's a reason behind this. There's so much science backing it up. It's not every day the government change their guideline age, by 5 years. All right. So this is huge. So screening, what it does, it finds cancers early. So then it prevents you from dying. So even if you have cancer, you're not dying from it because dying is when the cancer is spread all through your body, and that's associated with dying. So it means that 50% of people that get cancer die is because they never did the screening. They just presented when it's already spread. And unfortunately, it's a very bad prognosis, as I showed you before. Now, when people say, oh, it's too expensive to get screening, okay, most of these screening tests, a mammogram, prostate screening, colonoscopy, it's all free. In fact, the money they take from your paycheck, twice a month is actually going towards paying for your screening. That's included. So if every year between your employer putting in some money and you're putting in some money into that fund to pay for your family insurance or your insurance, guess what? You're paying almost $10,000 in insurance, and it's like paying $10,000 in lotto tickets, and you're not even cashing it in. So that just doesn't make sense. You're paying for this. You're paying, so it's free. You're already paying for it. So if you're paying for it, what's the price of diagnosed with end-stage colon cancer? Well, the price of the surgery, the price of chemotherapy, the price of radiation, the price of you out of work, the price that maybe you might survive, and everything else. That's a big price to pay. So when people say price, I would say it's cheaper to just get the screening done any day. I have another YouTube video, but I'm afraid I'll leave it for the end. All right. So who should start screening earlier? I said 45 is the limit. Can people go for colonoscopy earlier? The answer is yes. There are people, depending on your family history, and if you don't know your family history, then just go get screened anyway, because there are people that get cancer in their 30s. As I showed you, age is not a reason to limit yourself from actually getting screening. So there are certain genetic predispositions that can put us at risk. So yes, we can get screening earlier. What are the options? Okay, so yes, we can get some tests. There are some fecal tests that we can send. I'm sure everybody's seen it on television, Cologuard with the little box with a little guy walking around, right? So yes, they can send you the kit at home. You can put your stool in it and you can send that off. What that does, it looks at the DNA in the stool and it looks for DNA from the cancer itself, abnormal DNA. And so yes, you can use that as one, but colonoscopy is the gold standard. The difference, what's the difference? The difference is colonoscopy is not just diagnostic, it's also therapeutic. It removes it. It removes the polyp immediately. So one test is just telling you if you have it. It's not as sensitive, but the colonoscopy is removing it at the same time. So big difference. And if you have, okay, so say which test fits me? Which test is covered by my insurance? Those are the kind of questions you have to find out. But almost all insurance, even if it's a really bad insurance, they still pay for all these tests. So it's really free. Red flags. What are the symptoms? Right? Okay. Remember, this is just like plumbing. When something clogs the drain, or when any plumbing gets clogged, you start feeling bloated, right? And so everything starts backing up. You feel nauseous. You feel like vomiting. You may be constipated. You may have diarrhea. Changes happens in your bowel that has never happened before. You can also see, bleeding. Bleeding can happen. So if you have blood in your stool, remember, screening means asymptomatic. You have no symptoms at all is where you go for your screening. Once you have symptoms, it's no longer screening. You're in the treatment, you're in the diagnosis and treatment pathway. You missed the window. The window is gone. Okay, you're in the other part of diagnosing why you're having symptoms and treatment arm. This talk and this awareness is geared towards You're feeling fine. If you're feeling fine, you're the one that needs to go get screened. So no symptoms is screening. All right, just want to make that clear for the team. So now people say, when should I think about cancer? Well, guess what? All through your life. I just showed you, and I want to emphasize that again. People can get cancer at any age. Okay, there are people that get skin cancer, they can get melanoma, they can get it at 20 years old, 30 years old, any age. Cancer is not to be framed as an age-related issue. Okay, yes, it increases with age, but we want you to start thinking about this in every decade of life. When you're in your 20s to 30s, we need to think about, for women, they need to think about cervical cancer. They need to think about, for men, they need to think about, scrotal, exams, because you can have tumors in the scrotum. When we get to the 30s, decade of life, and 40s, that's where we start thinking about colon. And colon is 40s now. So in the 40th decade of life, 45 is the gold standard now, but you can go for it earlier if you have other family risk factors in there. If you have another sibling that died of colon cancer or also got it under age 50, it means you need to go and get screened earlier. 50 is still the cutoff for things like prostate cancer. Mammogram is already, 40s, but lung screening, I showed you on the map that lung cancer is really the leading cause of death out there. It's a pretty deadly cancer. So for people who smoked, even if you continue to smoke, it's free to get a lung screening test. It's called low dose CT scan. And so these things don't require any IVs, it don't require any preparation at all. You just have to show up and get your screening done. And this should be done throughout life, 60s and 70s years old. So beyond colon, I want to emphasize get your mammogram, prostate, and lung screening done also. All right, so what is the action steps we're going to do? We're going to say, let's pick what we're going to get screened for. So, call a friend tonight and say, hey, I'm going to go for my, colonoscopy. What do you have to do? And just take a friend, go get screening, start normalizing it because it's very important. True or false? Colorectal cancer is the second leading cancer killer. The answer is yes. All right, it's number 2. Both men and women get colorectal cancer. The answer is yes. Colorectal cancer often starts with no symptoms. Absolutely, yes. It starts sometime 10 years before symptoms actually hit us. Screening helps prevent colorectal cancer. The answer is yes. It picks it up early. I want to go over some other myth busters since we have some time. I'm too young for colorectal cancer. Guess what? Colorectal cancer seems to be increasing in adults under 50 years old, and they pushed it all the way to 45. But yes, it's becoming younger and younger. And for those of you who hit 50, you're way behind in getting your screening. If I have no symptoms, I don't need to screen. That's the whole point of screening. You don't want to wait for symptoms because by the time you get symptoms, it's already too late. It's unfortunate, but it's a very slippery road after you have symptoms. Colonoscopy is the only screening test. I answered that already. I told you no, we have other tests. We have the stool test that you can send off, and there are other DNA tests, and now there are blood tests that can also test for it. So there are different ways to really test. But remember, colonoscopy actually diagnose it, but it also treats it at the same time by removing the polyps altogether. The prep is unbearable. That was back in the old days. I think 10, 20 years ago. The prep is now very simple and very comfortable, so it's not the same as it used to be. Colonoscopy is too dangerous or too painful. Actually, it's not. And so a very good sedation today is used. A positive stool test means I have cancer. So I don't want people to think that at all. Positive stool test means that you need further workup because there are false positives. And so there are other reasons why the test could come out positive. So you don't have to have cancer if the test is positive. So still have to go and get colonoscopy and further workup. Screening is too expensive. I think I told you about that already. It's free compared to the price of surgery and chemotherapy and radiation therapy. That can take you up into the hundreds of thousands, depending on how severe the cancer has spread. It could even cost you your life if it's too late. Biopsies or surgery can make the cancer spread. This is actually one of the tumors that It can spread, but it won't spread if it's being pulled out from the colon itself. So in that way, it's not spreading inside, it's spreading outside as you pass stools. Cancer runs in my family, so there's nothing I can do. Actually, I just explained, picking it up early. The reason why it runs in the family is because they didn't pick it up on time. And that's why people are suffering, is because of the late stage. I'd rather not know. I'm afraid what I'll find. Well, it actually only delays discovery. So it's very important for you to get screened early and change that myth. When we look at all the different cancers we just talked about, lung cancer, as you can see, is the third line there. We still have some room to go. What's at the bottom there is lung cancer. You can see lung cancer is taking a very slow start off. But if you're a smoker and you're above age 50, it's a free lung screening test that has found lung cancer so early that it's not worth it to just stop smoking. It's worth it to get screened at age 50. So get the screening done. Okay, so what can we do to prevent cancers from forming? As you can see here from MD Anderson, one of the world's largest, cancer centers, all the cancer centers are now putting on there, this is what we need. And unfortunately, when you look at the US population and how much fruits and vegetables we take, we're not meeting the quota. And so clearly, this is the chemotherapy we should be taking in the first place, is the phytonutrients and the all-natural anti-inflammatory and antioxidants that's found in fruits and vegetables in the beginning. And so all of the American Institute for Cancer Research, this is what we should eat on your left, and this is what we should stay away from even after we have a diagnosis of cancer, because these are the cancer-causing foods right here. And so if these are the cancer-causing foods, this is the way to prevent cancer from forming in the first place. And again, when you look at all the different, this is called functional foods, where foods have medicine-like properties in it, you can see that a lot of nuts, fruits, vegetables have anti-cancer agents in them. And so that's really, with our deterioration, I think in the last 40 years of convenience, eating processed foods, that's where cancer has actually taken over. And we need to revert back to that. And that's where food is medicine now. When we look at the blue zones, where people live routinely to 100 years old, and we don't hear them getting cancers if they're living to 100. And so here we have people struggling to live to age 50, with cancer. And here you have people with, double the age living to 100. And you can see that their diet is key for whole grains, handful of nuts a day, beans, and fruits and vegetables, 5 to 10 servings. So clearly, that is the way to reduce the risk of cancer, is watch what you eat. And that's where this whole plate comes in, where 50% should be all plants, at least 50% of your plate every day, every meal, all plants to help prevent cancer from forming. So just to summarize, cancer screening exams for men, when you hit age 45, prostate, colon, that should be on top of your list. And we talk about lung cancer if you smoked, starting at age 50. For women, starting from age 21, cervical screening, cervical cancer is, it is a real cancer that affects women today. And so they need to get screened much earlier. And so same thing, mammogram at age 40 to 45 to prevent breast cancer, and then colonoscopy at the same 45 years old as men. So to summarize, smoking, cut it out. What's your diet? Mostly plant-based food. What's your weight? We talk about how obesity is associated with cancers. Get moving again, some physical activity. Don't have to be joining a gym. Just have to walk more or jump in jacks or skip rope. You don't need a gym in order to get active. Watch your skin with sunlight exposure, because skin cancers are also very prevalent, and staying up to date with the vaccines. There are some resources. This slide will be saved on the website. So for those who want the resources, it can be there. And this is just a table. Again, this will be your resource. You can take a picture of this. In every decade of life, there is something to do, just like tuning up your car every 10,000 miles, and you want your car to last a long time. Well, if you want the human body to last for 100 years, you need to do things in every decade of life. You just can't ignore it. because that's just a little bit irresponsible. So screening, I believe, is every decade of life. It's everybody's responsibility. We should share that with our friends and family at the table so everybody's aware that they need to get their screening done and hold people accountable and do it in a community setting. Again, this matrix is for you. These slides will be available online afterwards. And the next step to do tonight, choose what test you're going to do. You decide, right? Schedule it immediately because putting a time on it helps. Text two other people and tell them, hey, let's do this together. That's important to start getting other people involved. Write down your family history. If you don't know your family history, start calling your loved ones and finding out, hey, does anybody, grandma had any kind of cancer, grandpa, what did dad die of, or mom? I mean, those are the things you want to ask. You want to ask those questions because that could increase your risk of having the cancer and maybe even getting it earlier screening that your doctor needs to know. Make your visit list of all your medications whenever you go into the doctor. Confirm the appointment and any prep instructions. And if you have symptoms, it's no longer screening. You just have to go to your doctor and say you have symptoms and start getting a diagnostic workup. Totally different than screening. Screening means you feel fine. That's the purpose. That's how you catch it earlier. Thank you very much.
Thank you, Dr. Beckles.
You're,
It's
you're
did a great
welcome.
job. I mean, and you just performed so well within this time period. I don't know how you do it. Taking me 3 hours.
Thank you.
Um, I'm in healthcare, and each month I learn so much from these presentations, so I appreciate it. Thank you, everyone, for staying with us. We are going to open the chat for conversation, discussion. We already have one question in the chat I'm going to get to in just a moment, but I do want to ask Dr. Beckles one thing before I get to
Yes.
the question, Angela. And that is, I hear a lot from patients that they haven't gotten their colonoscopy because of fear, because of nervousness, because of almost like why folks don't get a root canal. Somebody told them that, it was this terrible procedure. What would you like the folks on the chat, on the webinar to know? Or what would you like them to share or impart with other folks that they might be speaking to about, what does the procedure entail? And, what are they supposed to expect? Those type of things. Because right
No,
now,
absolutely.
that's one of the biggest reasons people do not get their colonoscopy each year.
Right. And so I think the fear is real. I think people have, beliefs. And again, 10, 20 years ago is different than today. They may have stories about their grandpa having a colonoscopy or their grandma having a colonoscopy, which, today having any procedure is so much different than what it used to be. Okay, so that's number one. Number two is, when we look at statistics out there, we look at, the chance of being in an automobile accident, for instance, right? That's higher than something happening to you in any procedure. It's like 1 in 10,000 you can die from a colonoscopy, like 1 in 10,000. Like the numbers are so it's really about getting the numbers out there to people to understand how safe it's safer to get a colonoscopy than crossing the street.
Mm. Mhm.
Okay.
Good to
All right.
know. Yeah.
And that's the reality of it. I mean, you don't hear anybody dying of going for a colonoscopy. That's how routine it is. So you look at the numbers, those are the numbers that they really need to stress to remove the fear from people's minds. Sometimes, yeah, again, it's just what our beliefs are. But it's a very safe procedure. Um, it takes some prep, but it's the gold standard. It's the gold standard to remove one of the leading causes of death in the world. Now, when you talk about getting colon cancer and how invasive that is, they have to cut you in your belly and go in there and take your colon out. And sometimes you have a bag, a stool bag for months, or they may never reverse it, or you may die from it because now you got cancer spread throughout your whole body. I mean, that's what we're trying to prevent here. And so they really don't have a good idea. And that's where patient testimony comes in. But yes, I understand their fear.
Thank you.
You're welcome.
Okay. So, Angela, if you would like to, Angela Cooper, unmute and ask your question, that would be great. If not, I can read it for you.
You can read it, you would understand it.
Okay. So, Angela wrote, I know you have a mission trip to Tobago this year. Any possibility cancer screening during that trip?
Yes, there is a possibility for colon cancer screening during the trip. It's something that we're actually actively seeking, and we're going to be doing it a combination of, gastroenterologists, getting surgeons and gastroenterologists to come down on the trip with us, working with the Ministry of Health. In fact, I'm coming down to Trinidad at the end of this month. I'm meeting with the Minister of Health. And so we're going to go over what we can do, whether it's going to be those kits that they can put their stool in and massively screen people, or it's going to be credentialing my doctors to do colonoscopy. And what is the list that the government have? I need to see their list of waiting list. People are waiting on a list to get screening, and I'm pretty sure that the screening that they're waiting for is actually they have symptoms. And so it's already too late. So we're finding cancer in the Caribbean so late that that's where resources come in. Now, these guidelines I just shared with you, these guidelines are just in the United States. The Caribbean don't have any guidelines at all. Imagine that. There are no guidelines in the Caribbean or in most other third world countries of when you should get screening or when should a woman get a mammogram or any test at all. So that's very unfortunate.
Okay, thank you. We have a few
You're
other
welcome.
questions in the chat, but I know Mr. Davis raised his hand. Seems like he has a question for you.
Good evening. I think having these opportunities to share, as you said, is so important. Dr. Beckles, you did a fantastic job. What I wanted to do is just take an opportunity to share a little bit about myself. I came back to New York when I was in my 20s. And in my early 30s, I had a situation where there was blood in my stool. And to be honest, for a while, I didn't go immediately to the doctor. It was like, okay, you're questioning and almost hoping that this is going away, and it's not a serious thing. And it could have been something else. So I wound up going to the doctor and ultimately had a colonoscopy. And during the colonoscopy, it was identified that I had a bleeding polyp, and that was taken care of right then and there. I had to go for follow-ups, the year after, and then the year after, and then spread out. And so I just wanna share that experience. And to anyone on this call, if something is outside of normal, don't wait. Get out there, because I actually was very fortunate in the sense of the outcome, but I think I could have even been much more expeditious in getting to the doctor. So I wanted to share that. And we're talking about 45 is the new 50, as you said, Dr. Beckles. Well, I was in my early 30s when this happened. And fortunately, things have been taken care of, and I'm here to share this with you.
Absolutely. And that's exactly my point. I think we're going to be drifting down to the 30s. I mean, that's where we're headed. We're heading into the 30s. So people on this chat that are in their 50s and haven't even gotten screened, you're way behind. Don't think you have time. The screening is real. You should just get screened and get it done. Just know that it's clean. That's all you need to know, that the polyp develops over 10 years when it converts from a polyp to a cancer. all the diseases, cardiovascular disease, the stroke that you had, it didn't happen today. The heart attack you had, it didn't happen today. The colon cancer you had, it didn't happen today. It happened 10 years ago. And when it shows up in the emergency room or it shows up at bleeding, is when it's starting to cause symptoms. So nothing just happened today. All right. And that's for almost every disease out there. I would say 80% of diseases are preventable if we were to start developing that mind frame of us, getting screened, A, B, C, D, E's, know what your A1C is, be proactive, go and get it checked, get your blood pressure checked, get your cholesterol checked. Don't wait until you're having symptoms and regret, because that's when it's really too late, unfortunately.
If you have friends and family that mention to you that they have any kinds of symptoms, just encourage them to immediately go ahead and get checked out. And I think that's the best practice. That's why we're having these conversations. I think awareness is what's going to help us to get to where we want to be in 2026, which is all about prioritizing health. And, there are things that we can change, but where we can identify things early and get them taken care of, the results and the outcomes is so much better.
Absolutely. And you're already paying for it.
Absolutely. And I do think, especially as Caribbean people, I can certainly speak for Bayesian people, we naturally default to worst case scenarios. And I know that there are several other things that could possibly cause blood in the stool. So, just err on the side of caution. Okay. Speaking about polyps, Cheryl Hunter has a question. What exactly are polyps? What does polyp mean?
So polyp is just a growth. It's a growth in cells. And so we talk about having mutations. And so a polyp is still a benign growth. Like you can have a growth on your finger, you could have a growth on you could have a growth any part of your body. And so it's just cells dividing. But it's going from when we're talking about the colon itself, that's the name polyp is specific for a mass inside of the colon, inside of your intestines, that's growing and multiplying. And it looks like a cauliflower, it looks like a little tree. And I have a video to show that, and I think I'm going to load that up afterwards, where you see the polyp and you see them remove it, what it looks like to remove a polyp and how straightforward it is. So a polyp is a growth, and it converts into cancer over a 10-year period of time.
Okay, thank you. I hope
Good
that
question.
answered your question, Cheryl. Very good. Sharice would like to know, is a virtual colonoscopy?
Yeah, I just wanted to know if, sorry, this is Sharice.
Okay,
I've been hearing about the virtual colonoscopies. Is that an option for screening?
Yes.
Spoke about the committee. And why would what would be the reason why they will do the virtual?
Right. So we have a lot of technology today.
That's where I have the problem with calling them.
someone, I'm going to mute. I think this is
No,
Patricia.
sorry. That's me. Sorry.
No
Go
worries.
ahead. Mm-hmm.
That's all right. So we have different, colonoscopies. And so there are ones that they can put a camera inside, right? And it gets to see the entire inside of you and all that stuff. And so those are virtual. Again, those are not routinely used. They're used for people who cannot tolerate sedation at all, for people who are very sick. But again, the majority of screening is done with the gold standard. There's something called gold standard. Gold standard is what we've done thousands of, and we're very good at it. And so again, it's not just a colonoscopy, but you also treat it by removing the polyp. The virtual is just a camera that is seeing things inside of you and going through your entire from mouth all the way out. And so it gives you a picture of the inside and puts it together in a reconstruction. if the prep is not good, sometimes stool could look like polyp. And so you still need a colonoscopy after that. So people have just gone to colonoscopy and bypassed that altogether. You could use virtual if somebody had recent surgery, for instance, and they cannot go in with a colonoscopy right away. Sometimes that's one of the reasons why they can use the virtual. But there are different technologies out there that you can use, but the gold standard is the gold standard. Is the reason why I call gold standard.
Yes. The virtual one, they're unable to remove the polyps. They're only just taking pictures.
That's correct.
Yes. Okay. That is, because someone asked, and I said, well, I don't think it be, if you can do the colonoscopy, you should go ahead and do the colonoscopy instead of the virtual. Okay. Thank you.
You're welcome.
Very good. Thank you. We have another question in the chat from Felix. Felix, would you like to ask your question or I can read it for you?
Sure, I'll ask it, fellow Bajan.
Visions in the house.
Yes. Yeah, so I had two questions because after you mentioned about going to Trinidad, I had another follow-up question. But my question basically is like different cultures around the world have few issues with cancer. For example, the Japanese culture and the people who live in the Amazon, very few cases of cancer. And I was wondering, is that because of their diets are more plant-based?
Yes. Is that your question
Yeah,
or a
that's
statement?
yep, yes, combination of both, but yes. Just-
Absolutely. Clearly, in the United States, we have more of a problem with highly processed foods, but that's spreading across the world, and places that started off having a high plant-based diet, we're seeing that our kids are not in the last 40 years are more obese than ever before. So clearly, we have some work to do, and that's why it has to be customized. It has to be customized to you. You know yourself more than anyone else. You know what your diet is. You know if you have symptoms. You know your family history. And you know that screening is available starting from age 45. Okay, it's good to get a baseline screen done so you know it's clean, or if you pick up something, then for the rest of your life, you're going to be going, depending on how many polyps they found. And that's it. If it's negative and it's negative for first year, 5 years from now, 10 years from now, then that's fine. Then it's great. And keep up the good work. But getting screened is part of finding out if you have that first polyp that puts you at risk.
Okay, I did get a colonoscopy about 5 years ago, and fortunately everything was good, but the doctor said the next time will be another 10 years. Is that still
There
the
we
same?
go. That's what I mean. If it's clean, it's clean. If he looks at your diet, he looks at what you're eating, no family history. It takes 10 years to go from that polyp to full-blown tumor. So if you have nothing, it's going to take 10 years. So
Mhm.
you're pretty much okay. That's good news.
Okay, thank you. And
But what if you had a polyp already? What if you had a polyp at that time? Then that's not good news. But you found it early
Mhm,
rather than late.
correct. The other question is, you said you were going to Trinidad and Tobago. Are there any plans in your future to maybe try to coordinate with the Caribbean islands to do cancer screenings once a year or anything, or when your schedule permits?
So the goal is to cover the entire Caribbean, and we're talking from Haiti to Guyana. That's the goal. We're trying to get a lot of resources so we can cover the entire. Number one, it's bringing awareness. They already have resources locally in each of these countries. The goal is to bring talks like this to the people so they get their screening done and not just show up and needing chemotherapy. I get called from the government that we need chemotherapy here. Okay, wait a minute. We want chemotherapy. All right. What about screening? There's no screening. So it's really not about the chemotherapy. It's not about the new hospital. It's about bringing awareness and doing early screening so we don't need chemotherapy. You see the difference, right?
Yeah, preventive medicine, correct.
That's it. That's where it's at. We have the technology today. Again, 20, 30 years ago, the technology was not forthcoming. Now, we're looking at trying to purchase 10,000 of those kits so we can give 10,000 throughout the entire Caribbean from Haiti to Guyana to screen for colon cancer. It's that simple. It's really that simple. And so we're looking for sponsors to just sponsor that 10,000 kits and do the massive screening, and that will give us the answer. And so with the statistics so high, you're going to find people, hopefully not as young as 30 years old, but that need now to go on and get that further workup. Otherwise, they're going to show up before age 50 and they're going to die. They're not going to make it. Age 50 with colon cancer in the Caribbean is bad news. Very bad news.
All right, thank you, thank you. You said you're looking for sponsors? You mean spell it?
Yeah.
I may have someone in contact in Trinidad or Barbados, so I'll reach out to
Excellent.
What
Hollis.
about
Absolutely.
Tobago? What
And
about Tobago?
Tobago is part of the whole Caribbean when we put in brackets.
and we do have an email address that we check often, and so we can share that. I'll throw it in the chat as well. Okay,
Okay, thank you.
you're welcome.
Great questions, and thanks, Felix.
Yeah, so we know Felix is going to live to be 100 and contribute to Barbados having the highest amount of centenarians in the islands.
Right.
All right. Looking forward to hearing from you, Felix.
No
All
problem.
right. Miss Shirley has a question. Cologuard versus a colonoscopy. Can you?
Yes. So again, a Cologuard, some people are doing both, right? And so the Cologuard is for those who have a busy schedule. Again, you have to put priority. If you don't have risk factors, if you have no family members, all your family members live to 100, right? No cancer in your family. Everybody lives happy. You're eating fruits and vegetables every day. You're living as if you're living in the blue zones, right? Then yeah, you could do Cologuard. And then if it's positive, then you have to go for your colonoscopy. If it's negative, you could put off colonoscopy for another year. And then you do the Cologuard every year. So Cologuard basically is stool sample that you send off to the lab, and the lab is able to detect whether you have cancer cells in your stool. Because every day we shed layers of cells from our skin. Well, same thing inside our colon. We shed those cells, and colon cancer sheds its layers. And in those layers, the lab test will pick it up in the stool. So the only thing is there are some false positives. So sometimes it could be positive from just inflammation in the colon that can show up as cancer cells. But if it's negative, it decreases your chance of having full-blown cancer for sure. Colonoscopy, again, like I keep saying, is the gold standard. It's what detection and removal and early therapeutic intervention and taking gross pictures on the inside is all about. And these other therapies are there, but it must be personalized to you. What are your risk factors? What is your age? And do you have symptoms or not? And go with that.
Dr. Beckles,
Yes.
can you hear me? Okay. So what happened was when I had my colonoscopy, the doctor said, well, you have colonoscopy. He said, if you have no polyps, then we don't have to have any more colonoscopy. So anyway, I had the colonoscopy last year, and 3 small polyps were found. Thank goodness, no cancer. But once you have had polyps, then Cologuard is not an option, correct?
Well, you were lucky that you had the colonoscopy done and you found the polyps. Those would, if let's say you didn't have the colonoscopy done, then it means that you could have went on to get colon cancer, right?
Yes.
Okay, so now that you found the polyps, it means that whatever caused those polyps is still there. Did you have to change your diet? So the next step is to make sure that the polyps, did they get all of it? Having 3 polyps, it puts you at risk of having more polyps coming, because polyps are like these little trees that start growing, all right? And they're seeds that are planted everywhere in the entire colon lining. You found 3. You could have others that you just not budding out yet. And so it will be wise to do a colonoscopy as a follow-up to make sure that 1 didn't get away or 2 didn't get away, that they were too small to see on visualization. And after you cleared from polyps, for 1 or 2 more years, then you can switch to Cologuard, after that, if you would like. Does that make sense?
Yes, thank you.
Yep, we're dealing with just the second leading cause of death on planet Earth. So once you start having some stigmata of it, you have to take it very seriously.
Okay, thank you.
You're welcome.
We have a comment from Teresa. Teresa, would you like to share your comment to Dr. Beckles?
Yes. Good evening, everyone. Dr. Beckles, I am truly, truly grateful for the work that you're doing for the Caribbean people and also those in America, and the vision you have and also the passion you have for health and raising awareness. And I truly commend you and your team. May God continue to bless you. And as you go to Trinidad and also Tobago and expand to the Caribbean, Godspeed and blessings with you and your team. Thank you again for the great work that you continue to do.
Thank you very much. Thank you. It's teamwork.
Yeah, Miss Breton will be there too.
I am planning, I'm trying to make my schedule available to be there.
Good.
I would just like to chime in and piggyback on that. Of course, with the great job, but I think that we all have an opportunity to share and spread this information. I mean, many people are listening, and I mean, Dr. Beckles, he does a great job of preparing. But I would encourage you, if you have friends and you have family, we're putting together and getting out the flyers and the information early. Share with your family, with your friends, with your colleagues, with your coworkers, and encourage them to be a part of, what Dr. Beckles is trying to do. And the other thing is, for those who might have missed one of the previous sessions or this session, it will be available on the Kasoni YouTube channel, so you can send folks there to listen in and hear what was presented and shared tonight.
Excellent. Yes, it's all about bringing that awareness. So you're all part of this, webinar. My giving it, but you're also being first to hear it, but also first to spread it. So we need your help to get the word out on your social media, however it takes, because lives can be saved. People have these same fears that our first instinct is always to deny, right? No matter how sick we are, and we need to get over that and make it a habit, starting with our own selves. Lead by example. You all are leaders. Lead by example, then lead in the family, and then that will lead to community and hopefully nations. So that's the goal.
And just one other thing to mention, the cadence for our monthly sessions, it's the second Thursday of every month. And all the way through 2026, there are topics that are planned out. So the second Thursday of every month at 7 p.m., same bat station right here.
Eastern Standard.
Eastern Standard Time.
Very important point.
Yeah, Eastern Standard.
And I promise you will learn something every time.
Yes. If no one else is learning something, I'm learning something, Dr. Bell. Each time. All right, Angela Cooper. She would like to know, Angela, are you still on the call? I believe so. Would you like to ask your questions?
No, I just heard someone spoke about the what do you call it there? The
The virtual
virtual
body.
right. And I know that people do body scans also, so I wanted to know if it was the same thing and if body scans pick those up.
No, unfortunately, body scans, the resolution of these polyps are very small. The polyps are very small to be picked up on a body scan. Body scan needs at least 5 millimeters to be picked up. And these polyps can be smaller than that, unfortunately.
Okay.
Very good. Okay. We do have a few comments, but I think we may have answered those along the way. I don't believe, let's see, I think this is Deely. Deely may have left early, but she would like you to know, thank you, Dr. Beckles, an outstanding presentation. Here's what though. I am not fearful or nervous about having a colonoscopy done, but the thought of being snipped on the way up if polyps are sighted is terrifying. What are the possibilities of snipped polyps releasing God knows what, like a Pandora box? That was a good one.
Okay, so no, I mean, again, our imagination can really run wild with us. I put sound share. Let me see if I can share my screen. Let's try this one more time for the audience that's on. And let's see, this is a YouTube polyp to cancer. Let's see if it comes up. And let me know if you can hear it and see it. There's not much talking. This is inside the colon. This is the camera going inside the colon after a prep. That's the mucosa, which is the lining of inside your colon. And there's a polyp. They usually go above it to make sure there's nothing above it. They go below it. They want to make sure that they can go ahead and snare it safely to remove it. So that's a growth. That's what a polyp looks like on the inside. Okay. In the same scope that they have with the camera, it has different openings. They snip piece by piece, millimeter by millimeter. This is zoomed in 10x. So this is bigger than what you're seeing. Okay. And that's it. It's that simple. It's a really simple procedure, very benign, really not.
In this video, part 2 of 4, I'm going to explain.
Not anything that is very dangerous. It's very safe today than it ever was before, ever. So people should really not be afraid of it.
Very good. Thank you for sharing that. I think that was all that we had in the chat, unless anyone would like to kind of chime in before we wrap things up. Any additional thoughts or comments?
Yes, I did put in the chat because they were talking about
Dilly.
having something to do with the mission trip. So I said, yes, that's why TPA is raising funds so that we can afford to come down to the Caribbean to do what we have to do. So that's why I put in the chat.
Very good.
I'm going to play this last video. This was the video that I had at first, and that will be 1 minute long.
And the volume was working just now on the previous video, Dr. Beckles.
Thank you.
Love. Millions are diagnosed with cancer every single year, and the number is rising. Yet, each number is a person, and each person has a story. We're also parents, friends, brothers and sisters, lovers and dreamers, thinkers and achievers. We feel anger. We show resilience. We get lonely. We grieve. We deny. We heal. We are more than a number, more than a diagnosis, more than a disease. It's time to act. Time to put people and communities at the center of health systems and cancer care. We're unique in our needs, but united in our goals and united in our message. to give people a stronger voice and a more active role in their own health. Treat the person, not only the disease, so that everyone, everywhere, can get the care they need.
Thank you very much.
Thank you. Thank you. I'm sorry, Dealey, I didn't mean to skip over your comment. Appreciate you. And I appreciate TPA trying to raise money for a good cause here. Okay, Horace, would you like to share anything before I wrap things up, or?
No, I think you can wrap things up. Been another great session. And
Absolutely.
thank you for the work that you do to prepare and, make these go as smooth as they do.
I appreciate it.
Thank you all for everything you do, and people on the chat. Thanks for showing up. It's great.
We actually have one hand raised, and that is from Miss Charisse. Do you have time for another question, Dr. Beckles?
Always.
Go right ahead, Charisse.
Hi, Dr. Beckles.
Hello.
Hi, how are you? I just want to say to everyone, Dr. Beckles did an excellent presentation last month with my sorority on heart health. Everybody's still talking about it. Thank you, Dr. Beckles.
You're very welcome.
Yes. So I wanted the mission to do you have this every year? Is the trip going to Trinidad and Tobago every year?
The trip going to Trinidad and Tobago is through the Trinbago Progressive Association. We've been doing it every other year. I believe this is our 12th time doing it, so that's 24 years in the making. We are planning to, as we get sponsors, as we progress, I find myself in Trinidad 4 or 5 times a year easily. So I figure we can do it every year, provided we get the resources, we get the team together, and we grow the platform. The goal is to correspond with each of the ministers of health in each of the islands and to show them the way. Show them the way. They need to know how to implement a screening program, the ABCDEs, like we're talking about, rather than paying for downstream end of care, end of life, chemotherapy, heart attack, stroke. Why not prevent it? Why not do screenings? And so that's our goal for the next few years, is massive screening. Blood pressure, doing ABCs, A1C, blood pressure and cholesterol at a massive level. We're looking to get all of the machinery, and also colon cancer screening and prostate cancer screening.
Do you need to be part of the Trinbago Progressive to go on these trips?
Absolutely not.
Okay.
Absolutely not.
That was my question. I mean, I would have loved, but this summer I've already have something planned. But if whenever next, I will really like to go.
Absolutely. You're welcome.
Thank
All
you.
right. You're most welcome.
Love to hear it. Love to hear it. Love to see it. Love to hear it. I wholeheartedly agree with you, Dr. Beckles. This preventative care is so important. It's better to, I tell the students all the time, it's better to keep up than to catch up, right? So
Yep.
very good.
There you go.
If no one else has any questions, I'll go ahead and I'll wrap things up for tonight.
Thank you.
You're welcome. Okay, so in closing, on behalf of Trinbago Progressive Association of the USA and Casoni, we hope you all enjoyed this session. Again, we're doing this every month, so please feel free to share with your friends, family, coworkers, and leave inspired, hopefully tonight, to continue prioritizing your health and wellness, okay? Thank you all for your time. I went ahead and I dropped our email in the chat, so feel free to reach out to us. I check that email often, so hopefully, some of you all that express interest tonight, I will see some messages from you all trickling over the next couple of weeks, okay? With that, I will go ahead and I'll close out our webinar for tonight. Thank you all for joining.
Thank you all. Thank you, everyone.
Thank you all. Have a good
Thank
night.
you. Have a good night.
Good night.